1. What is the primary pathophysiological mechanism of celiac disease? A. Autoimmune-mediated destruction of pancreatic beta cells. B. Autoimmune-mediated destruction of intestinal villi. C. Bacterial overgrowth in the small intestine. D. Chronic inflammation of the colon. Answer: autoimmune-mediated destruction of intestinal villi. Rationale: celiac disease is an autoimmune disorder where ingestion of gluten triggers an immune response that damages the villi in the small intestine, leading to malabsorption. Options A, C, and D describe other conditions, type 1 diabetes, SIBO, and ulcerative colitis, respectively. 2. Which of the following is a common symptom of celiac disease in adults? A. Chronic diarrhea. B. Hematuria. C. Bradycardia. D. Weight gain. Answer: chronic diarrhea. Rationale: chronic diarrhea is a hallmark symptom due to malabsorption. Hematuria, B, is more commonly associated with kidney disease. Bradycardia, C, is unrelated, and weight gain, D, is uncommon due to nutrient malabsorption. 3. Which of the following antibodies is most commonly tested for in suspected celiac disease? A. Antinuclear antibody, ANA. B. Antimitochondrial antibody, AMA. C. Tissue transglutaminase antibody, TGIGA. D. Anticyclic citrullonated peptide, anti-CCP. Answer: tissue transglutaminase antibody, TTGIGA. Rationale: TGIGA is the most sensitive and specific serological marker for celiac disease. ANA, A, is linked to lupus, AMA, B, to primary biliary cholangitis, and anti-CCP, D, to rheumatoid arthritis. 4. A patient with newly diagnosed celiac disease asks what foods they should avoid. Which of the following should the nurse include in dietary education? A. Brown rice, corn, and quinoa. B. Wheat, barley, and rye. C. Fruits, vegetables, and nuts. D. Dairy, eggs, and poultry. Answer: wheat, barley, and rye. Rationale: celiac disease requires strict avoidance of gluten-containing grains such as wheat, barley, and rye. Brown rice, corn, and quinoa, A, are gluten-free. Options C and D contain gluten-free foods. 5. What is the gold standard test to confirm a diagnosis of celiac disease? A. Upper endoscopy with small bowel biopsy. B. Abdominal ultrasound. C. Colonoscopy. D. Hydrogen breath test. Answer: upper endoscopy with small bowel biopsy. Rationale: the definitive diagnosis of celiac disease is confirmed by small bowel biopsy, which shows villus atrophy. Abdominal ultrasound, B, is not diagnostic. Colonoscopy, C, assesses the colon, and a hydrogen breath test, D, is used for lactose intolerance or SIBO. 6. What is the most effective long-term management for celiac disease? A. Lifelong adherence to a gluten-free diet. B. Daily corticosteroid therapy. C. Weekly B12 injections. D. Intermittent use of proton pump inhibitors. Answer: lifelong adherence to a gluten-free diet. Rationale: the only proven treatment for celiac disease is strict lifelong avoidance of gluten. Corticosteroids, B, are used in refractory cases. B12 injections, C, may help if there is deficiency, but are not the primary treatment. PPIs, D, are used for GERD, not celiac disease. 7. Which of the following grains is safe for a patient with celiac disease? A. Oats, non-certified gluten-free.
B. Rye.
C. Barley. D. Buckwheat. Answer: buckwheat. Rationale: buckwheat is naturally gluten-free. Oats, A, can be contaminated unless certified gluten-free. Rye, B, and barley, C, contain gluten. 8. In pediatric patients, which of the following is a common extraintestinal symptom of celiac disease? A. Delayed growth. B. Recurrent urinary tract infections. C. Hypothyroidism. D. Hyperglycemia. Answer: delayed growth. Rationale: malabsorption leads to poor nutrient intake and delayed growth in children. UTIs, B, are unrelated. Hypothyroidism, C, may coexist but is not a primary symptom, and hyperglycemia, D, is seen in diabetes. 9. A patient with suspected celiac disease undergoes serologic testing. What is the first-line antibody test recommended? A. Anti-endomysial antibody, EMA. B. Tissue transglutaminase IgA, TGIGA. C. Anti-gliadin antibody. D. Antiparietal cell antibody. Answer: tissue transglutaminase IgA, TTGIGA. Rationale: TGIGA is the most sensitive and specific test. EMA-A is also useful but less sensitive. Anti-gliadin C is not as specific. Antiparietal cell antibodies D are associated with pernicious anemia. 10. A patient with celiac disease presents with severe fatigue and tingling in their hands and feet. Which deficiency is most likely responsible? A. Vitamin A, B. Vitamin D, C. Vitamin B12.
D. Potassium.
Answer: vitamin B12. Rationale: B12 deficiency due to malabsorption can cause neuropathy and fatigue. Vitamin A affects vision. Vitamin D affects bones, and potassium, D, affects cardiac function. 11. Which of the following is a complication of untreated celiac disease? A. Hepatocellular carcinoma. B. It's iron deficiency anemia. C. Myasthenia gravis. D. Polycystic ovarian syndrome, POS. Answer: iron deficiency anemia. Rationale: malabsorption of iron is common in untreated celiac disease. Hepatocellular carcinoma, A, is more linked to hepatitis. Myasthenia gravis, C, is an autoimmune disorder of the neuromuscular junction, and POS, D, is a reproductive disorder. 12. Which symptom is more commonly seen in celiac disease in adults rather than children? A. Chronic diarrhea. B. Dermatitis herpetiformis. C. Failure to thrive. D. Delayed puberty. Answer: dermatitis herpetiformis. Rationale: dermatitis herpetiformis, B, is a hallmark skin manifestation in adults. Failure to thrive, C, and delayed puberty, D, are more common in pediatric cases. Chronic diarrhea, A, is seen in both age groups. 13. Which of the following findings on an intestinal biopsy is characteristic of celiac disease? A. Crypt hyperplasia and villus atrophy. B. Pseudopolyps. C. Goblet cell hyperplasia. D. Casseeding granulomas. Answer: crypt hyperplasia and villus atrophy. Rationale: the hallmark histological features of celiac disease are crypt hyperplasia and villus atrophy. Pseudopolyps, B, are found in ulcerative colitis, goblet cell hyperplasia, C, in chronic infections, and casseeding granulomas, D, in tuberculosis. 14. A patient with newly diagnosed celiac disease asks when they can expect symptom relief after starting a gluten-free diet. What is the typical time frame? A. 1 to 2 days. B. 1 to 2 weeks. C. 1 to 2 months. D. 6 to 12 months. Answer: 1 to 2 weeks. Rationale: most patients experience symptom improvement within a few weeks, but complete healing of the intestine can take months. 15. A patient with refractory celiac disease is not improving on a gluten-free diet. What is the next best step? A. Check for hidden gluten exposure. B. Start corticosteroid therapy. C. Increase fiber intake. D. Perform gastric bypass. Answer: check for hidden gluten exposure. Rationale: the first step in refractory cases is confirming adherence to a gluten-free diet. Steroids, B, may be needed if dietary control fails. Increasing fiber, C, is not specific to celiac disease. Gastric bypass, D, is unrelated. 16. Which of the following is not a risk factor for developing celiac disease? A. HLA-DQ2 or HLA-DQ8 genotype. B. First-degree relative with celiac disease. C. Smoking. D. Type 1 diabetes. Answer: smoking. Rationale: celiac disease is strongly linked to genetic predisposition and autoimmune conditions like type 1 diabetes. Smoking, C, is not a known risk factor. 17. Which of the following deficiencies is least likely to occur in celiac disease? A. Vitamin K, B. Folate. C. Magnesium. D. Sodium. Answer: sodium. Rationale: Malabsorption in celiac disease affects fat-soluble vitamins like K, folate, and minerals like magnesium. Sodium is not commonly affected. 18. What is the typical age of onset for celiac disease symptoms in children? A. First 6 months of life. B. 6 months to 2 years. C. 5 to 10 years. D. After puberty. Answer: 6 months to 2 years. Rationale: symptoms typically appear after gluten is introduced into the diet, usually around 6 months to 2 years. 19. Which of the following is considered a classic symptom of celiac disease? A. Abdominal pain and bloating. B. Hemoptysis. C. Urinary incontinence. D. Jaundice. Answer: abdominal pain and bloating. Rationale: celiac disease frequently presents with abdominal pain and bloating. Hemoptysis, B, is related to lung diseases, urinary incontinence, C, is unrelated, and jaundice, D, is more indicative of liver dysfunction. 20. A patient with celiac disease is at an increased risk for which type of cancer? A. Pancreatic cancer. B. Colorectal cancer, C. Enteropathy-associated T-cell lymphoma. D. Hepatoblastoma. Answer: enteropathy-associated T-cell lymphoma. Rationale: long-term untreated celiac disease increases the risk of enteropathy-associated T-cell lymphoma. Colorectal cancer, B, is more related to inflammatory bowel disease, while pancreatic cancer, A, and hepatoblastoma, D, are unrelated. 21. Which of the following food items is safe for a patient with celiac disease? A. Whole wheat bread. B. Rye crackers. C. Corn tortillas. D. Barley soup. Answer: corn tortillas. Rationale: corn is naturally gluten-free, while wheat, rye, and barley all contain gluten. 22. A patient with celiac disease presents with bone pain and multiple fractures. What deficiency should be suspected? A. Vitamin A. B. Vitamin D. C. Vitamin C. D. Zinc. Answer: vitamin D. Rationale: malabsorption of vitamin D can lead to osteopenia and osteoporosis, causing bone pain and fractures. 23. Which of the following autoimmune disorders is most commonly associated with celiac disease? A. Rheumatoid arthritis. B. Systemic lupus erythematosus. C. Type 1 diabetes mellitus. D. Myasthenia gravis. Answer: type 1 diabetes mellitus. Rationale: type 1 diabetes and celiac disease share a genetic predisposition, HLA DQ2/DQ8. 24. A patient with celiac disease asks about alternative grains. Which of the following is not safe? A. Quinoa. B. Rice. C. Barley. D. Amaranth. Answer: barley. Rationale: barley contains gluten, while quinoa, rice, and amaranth are gluten-free. 25. A patient with celiac disease complains of persistent diarrhea despite following a gluten-free diet. What is the most likely cause? A. Lactose intolerance. B. Viral gastroenteritis. C. Colon cancer. D. Bacterial overgrowth. Answer: lactose intolerance. Rationale: secondary lactose intolerance is common due to villus atrophy affecting lactase enzyme production. 26. What is the primary reason for delayed diagnosis of celiac disease in adults? A. Atypical or silent symptoms. B. Limited availability of serologic tests. C. Lack of awareness among physicians. D. Genetic factors delaying onset. Answer: atypical or silent symptoms. Rationale: many adults present with extraintestinal symptoms such as anemia, fatigue, or osteoporosis, making diagnosis challenging. Limited test availability, B, is not a common issue, and while physician awareness, C, plays a role, atypical symptoms are the main reason. Genetic factors, D, influence predisposition but not diagnostic delay. 27. A patient newly diagnosed with celiac disease asks if they need to avoid oats. What is the best response? A. All oats contain gluten, so you must avoid them completely. B. Pure, uncontaminated oats are generally safe in moderation. C. You can eat any type of oats, as gluten is only in wheat. D. Oats are safe only if consumed with digestive enzymes. Answer: Pure, uncontaminated oats are generally safe in moderation. Rationale: oats themselves do not contain gluten but can be cross-contaminated. Certified gluten-free oats are usually safe, but some individuals may still react to them. 28. A patient with celiac disease is at risk for which vitamin deficiency due to fat malabsorption? A. Vitamin B12. B. Vitamin C. C. Vitamin E. D. Vitamin K. Answer: Vitamin E. Rationale: fat-soluble vitamin deficiencies, A, D, E, K, are common in celiac disease. Vitamin E deficiency can lead to neurological symptoms. While vitamin K, D, is also fat-soluble, it is less commonly deficient. Vitamin B12, A, is mainly affected in pernicious anemia, and vitamin C, B, is water-soluble. 29. Which of the following lab findings is most indicative of celiac disease? A. Positive anti-tissue transglutaminase, TTG, IgA antibodies. B. Elevated C-reactive protein, CRP. C. Decreased serum albumin. D. Elevated white blood cell count. Answer: positive anti-tissue transglutaminase, TTG, IgA antibodies. Rationale: the TTG-IgA antibody test is the most sensitive and specific screening test for celiac disease. CRP, B, and WBC count, D, indicate inflammation but are nonspecific. Low albumin, C, may occur in malnutrition, but is not diagnostic. 30. A 45-year-old woman with untreated celiac disease presents with chronic diarrhea, weight loss, and blistering skin lesions. What condition should be suspected? A. Dermatitis herpetiformis. B. Atopic dermatitis. C. Psoriasis. D. Erythema multiforme. Answer: dermatitis herpetiformis. Rationale: dermatitis herpetiformis is a characteristic skin manifestation of celiac disease, presenting as itchy, blistering rashes. Atopic dermatitis, B, and psoriasis, C, are unrelated, while erythema multiforme, D, is usually caused by infections or drug reactions. 31. Which of the following factors plays the most significant role in the pathogenesis of celiac disease? A. Helicobacter pylori infection. B. Autoimmune response to gluten. C. Pancreatic enzyme deficiency. D. Overuse of antibiotics. Answer: autoimmune response to gluten. Rationale: celiac disease is an autoimmune disorder triggered by gluten ingestion, leading to intestinal damage. Helicobacter pylori, A, is associated with ulcers. Pancreatic enzyme deficiency, C, is linked to exocrine pancreatic insufficiency and antibiotic overuse. D, is unrelated. 32. Which genetic markers are most commonly associated with celiac disease? A. HLA-DR4 and HLA-B27. B. HLA-DQ2 and HLA-DQ8. C. HLA-A1 and HLA-CW6. D. HLA-DR3 and HLA-DQ7. Answer: HLA-DQ2 and HLA-DQ8. Rationale: the presence of HLA-DQ2 or HLA-DQ8 is strongly associated with celiac disease. Other HLA markers are associated with different autoimmune conditions. 33. A patient with suspected celiac disease undergoes an upper endoscopy with biopsy. Which histological finding is most characteristic of the disease? A. Crypt hyperplasia and villus atrophy. B. Goblet cell hyperplasia. C. Thickened submucosa with fibrosis. D. Neutrophilic infiltration of the crypts. Answer: crypt hyperplasia and villus atrophy. Rationale: celiac disease leads to mucosal damage characterized by villus atrophy, crypt hyperplasia, and increased intraepithelial lymphocytes. Goblet cell hyperplasia, B, occurs in inflammatory conditions, while C and D are not typical findings. 34. What is the most common presenting symptom of celiac disease in adults? A. Chronic diarrhea. B. Constipation. C. Skin rashes. D. Joint pain. Answer: chronic diarrhea. Rationale: chronic diarrhea due to malabsorption is the most common symptom in adults. Constipation, B, may occur but is less common. Skin rashes, C, are seen in dermatitis herpetiformis and joint pain, D, is an extraintestinal manifestation. 35. Which of the following is not a common complication of untreated celiac disease? A. Osteoporosis. B is iron deficiency anemia. C. Nephrotic syndrome. D. Infertility. Answer: nephrotic syndrome. Rationale: nephrotic syndrome is not typically associated with celiac disease. Osteoporosis, A, anemia, B, and infertility, D, are well-documented complications due to malabsorption. 36. Which of the following conditions is most commonly associated with celiac disease? A. Addison's disease. B. Graves' disease. C. Hashimoto's thyroiditis. D. Multiple sclerosis. Answer: Hashimoto's thyroiditis. Rationale: autoimmune thyroid disorders, especially Hashimoto's thyroiditis, have a strong association with celiac disease due to shared genetic predisposition. 37. Which test should be performed first when diagnosing suspected celiac disease? A. Small bowel biopsy. B. IgA antitissue transglutaminase (TIG) test. C. Genetic testing for HLA DQ2/DQ8. D. Anti-nuclear antibody ANA test. Answer: IgA antitissue transglutaminase (TIG) test. Rationale: the TIG-IgA test is the first-line screening test due to its high sensitivity and specificity. A biopsy, A, confirms the diagnosis, genetic testing, C, supports risk assessment, and ANA, D, is unrelated. 38. A patient with celiac disease has persistently elevated TIG-IgA levels despite following a gluten-free diet. What is the most likely explanation? A. Hidden gluten exposure. B. IgA deficiency. C. Viral gastroenteritis. D. Overconsumption of fiber. Answer: hidden gluten exposure. Rationale: persistently elevated antibodies suggest continued gluten ingestion, often due to unintentional exposure. IgA deficiency, B, affects initial diagnosis, but not follow-up antibody levels. 39. Which of the following medications should be used cautiously in a patient with celiac disease due to potential gluten contamination? A. Metformin. B. Levothyroxine. C. Warfarin. D. Over-the-counter supplements. Answer: over-the-counter supplements. Rationale: some supplements may contain gluten, requiring careful label examination. Prescription medications, A, B, C, are usually gluten-free but should be verified. 40. What is the gold standard for confirming a diagnosis of celiac disease? A. Small bowel biopsy. B. Stool antigen test. C. Genetic testing. D. Serum albumin levels. Answer: small bowel biopsy. Rationale: a biopsy demonstrating villus atrophy is the definitive test. Stool antigen tests, B, do not diagnose celiac disease. Genetic testing, C, assesses risk, and albumin levels, D, reflect malnutrition. 41. Which of the following is a major risk factor for celiac disease? A. Family history of type 2 diabetes. B. A diet high in refined carbohydrates. C. Family history of celiac disease. D. Overconsumption of gluten-containing foods. Answer: family history of celiac disease. Rationale: a family history of celiac disease increases the risk due to genetic predisposition, specifically the presence of HLA-DQ2 or HLA-DQ8 genes. Type 2 diabetes, A, and refined carbohydrates, B, are not significant risk factors. 42. Which clinical manifestation is most specific to dermatitis herpetiformis in celiac disease? A. Itchy, blistering skin lesions. B. Large, scaly patches on the skin. C. Smooth, red, painful ulcers. D. Flat, brown-colored rashes. Answer: itchy, blistering skin lesions. Rationale: dermatitis herpetiformis is a skin manifestation of celiac disease characterized by intensely itchy, blistering lesions. Other rashes, B, C, D, are not typical of dermatitis herpetiformis. 43. A patient with celiac disease develops osteopenia. Which of the following is the most likely cause? A. Malabsorption of calcium and vitamin D. B. Increased bone formation. C. Increased calcium intake. D. Overuse of corticosteroids. Answer: malabsorption of calcium and vitamin D. Rationale: celiac disease can cause malabsorption of fat-soluble vitamins, including vitamin D and calcium, leading to bone mineral loss and osteopenia. 44. Which of the following is the most important component of the management plan for celiac disease? A. Immunosuppressive therapy. B. A lifelong gluten-free diet. C. Regular blood transfusions. D. Oral corticosteroids. Answer: a lifelong gluten-free diet. Rationale: the cornerstone of celiac disease management is adherence to a strict, lifelong gluten-free diet, which allows healing of the intestine and prevents further damage. 45. Which of the following foods should a patient with celiac disease avoid? A. Rice. B. Quinoa.
C. Barley.
D. Oats. Answer: barley. Rationale: barley contains gluten, which should be avoided in celiac disease. Rice, A, and quinoa, B, are naturally gluten-free, but oats, D, may be cross-contaminated. 46. A 10-year-old child presents with growth failure, diarrhea, and abdominal distension. What tests should be performed first to investigate celiac disease? A. Anti-endometrial antibody test. B. Small bowel biopsy. C. Genetic testing for HLA DQ2/DQ8. D. Stool fat test. Answer: anti-endometrial antibody test. Rationale: the anti-endometrial antibody test is a good first-line diagnostic test for celiac disease. Small bowel biopsy, B, is used for confirmation, and genetic testing, C, is supportive but not diagnostic. 47. A 35-year-old woman with celiac disease presents with abdominal bloating and discomfort. What is the next step in her management? A. Initiate a gluten-free diet. B. Prescribe antibiotics for a possible bacterial overgrowth. C. Perform a colonoscopy. D. Administer anti-inflammatory medications. Answer: initiate a gluten-free diet. Rationale: the first step in managing symptoms of celiac disease is ensuring the patient adheres to a strict gluten-free diet. Bacterial overgrowth, B, and colonoscopy, C, may be considered if symptoms persist, but diet is primary. 48. Which vitamin deficiency is commonly associated with celiac disease due to malabsorption? A. Vitamin B12. B. Vitamin C. C. Vitamin D. D. Vitamin K. Answer: vitamin D. Rationale: vitamin D is fat-soluble, and its deficiency is common in celiac disease due to malabsorption. Vitamin B12, A, can also be deficient, but is less directly related to celiac disease. 49. A patient with celiac disease has persistent symptoms despite following a gluten-free diet. What should be evaluated next? A. Adherence to the gluten-free diet. B. Presence of a secondary autoimmune disorder. C. Level of physical activity. D. Type of cooking utensils used. Answer: adherence to the gluten-free diet. Rationale: persistent symptoms often suggest hidden gluten exposure. Ensuring strict adherence to the gluten-free diet is the first step. Secondary autoimmune disorders, B, and other factors should be evaluated later. 50. A patient with celiac disease and osteoporosis is advised to take calcium supplements. What is the most appropriate form of calcium supplementation? A. Calcium carbonate. B. Calcium phosphate. C. Calcium citrate. D. Calcium gluconate. Answer: calcium citrate. Rationale: calcium citrate is the most appropriate form for patients with celiac disease, as it is less affected by the presence of food and is well absorbed in individuals with impaired gut function. 51. Which of the following is a long-term complication of untreated celiac disease? A. Pancreatic cancer. B. Lymphoma. C. Chronic diarrhea. D. Colon cancer. Answer: lymphoma. Rationale: untreated celiac disease is associated with an increased risk of developing certain types of lymphoma, particularly enteropathy-associated T-cell lymphoma. Pancreatic cancer, A, and colon cancer, D, are not directly related, and chronic diarrhea, C, may be a symptom but not a long-term complication. 52. Which of the following laboratory tests is used to monitor the effectiveness of treatment in celiac disease? A. Blood glucose levels. B. Liver function tests. C. Anti-TTG IgA antibody levels. D. Hemoglobin levels. Answer: anti-TTG IgA antibody levels. Rationale: the anti-TTG IgA antibody test is used to monitor adherence to the gluten-free diet and the healing process in patients with celiac disease. Blood glucose, A, and liver function tests, B, are unrelated to monitoring celiac disease. 53. A 25-year-old woman with celiac disease presents with recurrent diarrhea and weight loss despite adherence to a gluten-free diet. Which condition should be suspected? A. Lactose intolerance. B. Small intestinal bacterial overgrowth, SIBO. C. Pancreatic insufficiency. D. Irritable bowel syndrome, IBS. Answer: small intestinal bacterial overgrowth, SIBO. Rationale: SIBO is common in celiac disease and can cause diarrhea and weight loss. Lactose intolerance, A, pancreatic insufficiency, C, and IBS, D, are possible but less likely. 54. What is the role of genetic testing in the diagnosis of celiac disease? A, it confirms the diagnosis. B, it rules out the diagnosis. C, it helps assess the risk. D, it identifies complications. Answer: it helps assess the risk. Rationale: genetic testing for HLA-DQ2 and HLA-DQ8 helps assess an individual's genetic predisposition, but does not confirm or rule out the diagnosis. 55. A patient with celiac disease develops recurrent mouth ulcers. Which deficiency is most likely responsible? A. Vitamin C. B. Vitamin B12. C. Vitamin D. D. Iron. Answer: vitamin B12. Rationale: vitamin B12 deficiency can cause recurrent mouth ulcers and is common in celiac disease due to malabsorption. Vitamin C, A, is more related to scurvy, and vitamin D, C, deficiency causes bone issues. 56. A 6-year-old child presents with irritability, abdominal bloating, and poor weight gain. What is the most likely cause? A. Celiac disease. B. Lactose intolerance. C. Acute viral gastroenteritis. D. Crohn's disease. Answer: celiac disease. Rationale: children with celiac disease often present with gastrointestinal symptoms such as bloating and poor weight gain. Lactose intolerance, B, and gastroenteritis, C, are possible but less likely to cause such chronic issues. 57. A patient with celiac disease has a family member recently diagnosed with the condition. What should be recommended for the family member? A. Genetic testing and serologic screening. B. Immediate biopsy of the small intestine. C. A gluten-free diet. D. Testing for liver enzymes. Answer: genetic testing and serologic screening. Rationale: family members of individuals with celiac disease should undergo genetic testing for HLA-DQ2/DQ8 and serologic screening, even if asymptomatic, to detect early disease. 58. Which of the following is a key feature of the gluten-free diet in celiac disease? A. Complete avoidance of wheat, barley, and rye. B. Limiting fruits and vegetables. C. High intake of processed foods. D. Consumption of dairy products. Answer: complete avoidance of wheat, barley, and rye. Rationale: the gluten-free diet requires strict avoidance of foods containing gluten, which includes wheat, barley, and rye. Fruits, vegetables, and dairy are typically safe unless the patient has additional intolerances. 59. A 40-year-old male with celiac disease is seen for routine follow-up. Which of the following should be assessed regularly? A. Blood pressure. B. Bone mineral density. C. Vision. D. Liver function tests. Answer: to promote gut healing and prevent damage. Rationale: the gluten-free diet primarily helps heal the intestinal mucosa and prevents further damage caused by gluten exposure. It does not directly improve digestive enzyme function or weight loss. 60. A patient with celiac disease is advised to maintain a gluten-free diet. What is the primary goal of this dietary intervention? A. To improve digestive enzyme function. B. To prevent autoimmune complications. C. To promote gut healing and prevent damage. D. To reduce weight gain. Answer: to promote gut healing and prevent damage. Rationale: The gluten-free diet primarily helps heal the intestinal mucosa and prevents further damage caused by gluten exposure. It does not directly improve digestive enzyme function or weight loss. 61. Which of the following foods must be completely avoided in a gluten-free diet for celiac disease? A. Rice. B. Oats. C. Barley. D. Corn. Answer: barley. Rationale: barley contains gluten and must be avoided. Rice, A, and corn, D, are gluten-free. Oats, B, can be contaminated with gluten unless certified gluten-free. 62. A patient with celiac disease has unexplained weight loss and severe malnutrition despite adhering to a gluten-free diet. What condition should be suspected? A. Refractory celiac disease. B. Crohn's disease. C. Irritable bowel syndrome. D. Peptic ulcer disease. Answer: refractory celiac disease. Rationale: refractory celiac disease occurs when symptoms persist despite a strict gluten-free diet. Crohn's, B, and IBS, C, have different etiologies, and PUD, D, does not cause malabsorption. 63. What is the primary cause of osteoporosis in celiac disease patients? A. Increased parathyroid hormone secretion. B. Malabsorption of calcium and vitamin D. C. Chronic inflammation of the joints. D. Excessive dietary fiber intake. Answer: malabsorption of calcium and vitamin D. Rationale: intestinal damage in celiac disease leads to poor absorption of calcium and vitamin D, increasing the risk of osteoporosis. 64. Which of the following extraintestinal symptoms is most commonly associated with celiac disease? A. Skin rash. B. Visual disturbances. C. Frequent urination. D. Hypertension. Answer: skin rash. Rationale: dermatitis herpetiformis, a blistering rash, is a well-known extraintestinal manifestation of celiac disease. Other options are not commonly linked. 65. Which of the following grains is safe for a patient with celiac disease? A. Rye. B. Quinoa.
C. Wheat.
D. Barley. Answer: quinoa. Rationale: quinoa is a naturally gluten-free grain. Rye, A, wheat, C, and barley, D, contain gluten and must be avoided. 66. Which serologic test is considered most sensitive for detecting celiac disease? A. Anti-gliadin antibodies, AGA. B. Anti-endomysial antibodies, EMA. C. Tissue transglutaminase IgA, TTG-IgA. D. Total serum IgA. Answer: tissue transglutaminase IgA, TTG-IgA. Rationale: the TTG-IgA test has the highest sensitivity and specificity for celiac disease. EMA-B is also useful but less commonly used. 67. A 6-year-old child with celiac disease presents with dental enamel defects. What is the likely cause? A. Malabsorption of fluoride. B. Autoimmune enamel hypoplasia. C. Vitamin C deficiency. D. Chronic bacterial infections. Answer: autoimmune enamel hypoplasia. Rationale: celiac disease can cause enamel defects due to autoimmune-mediated damage during tooth development. 68. Which of the following is not a risk factor for developing celiac disease? A. First-degree relative with celiac disease. B. Type 1 diabetes mellitus. C. Obesity. D. Down syndrome. Answer: obesity. Rationale: obesity is not a risk factor for celiac disease, whereas genetic predisposition, autoimmune diseases, and chromosomal disorders like Down syndrome increase the risk. 69. Which vitamin is most commonly deficient in celiac disease? A. Vitamin A. B. Vitamin D. C. Vitamin K. D. Vitamin B12. Answer: vitamin D. Rationale: malabsorption of fat-soluble vitamins, particularly vitamin D, is common in celiac disease, contributing to osteoporosis risk. 70. Which type of anemia is most commonly seen in celiac disease? A. Iron deficiency anemia. B. Hemolytic anemia. C. Sickle cell anemia. D. Aplastic anemia. Answer: iron deficiency anemia. Rationale: celiac disease impairs iron absorption in the small intestine, leading to iron deficiency anemia. 71. A 50-year-old woman with untreated celiac disease is at risk for which of the following long-term complications? A. Heart disease. B. Colon cancer. C. Infertility. D. Chronic obstructive pulmonary disease. Answer: infertility. Rationale: untreated celiac disease can lead to infertility due to nutrient malabsorption, especially folate and iron. Heart disease, A, and COPD, D, are not directly linked. 72. What is the main purpose of a small bowel biopsy in diagnosing celiac disease? A. To detect the presence of bacteria. B. To confirm villus atrophy. C. To check for an autoimmune disorder. D. To examine for cancer cells. Answer: to confirm villus atrophy. Rationale: the small bowel biopsy is performed to confirm villus atrophy, which is characteristic of celiac disease. Bacterial presence, A, and cancer, D, are not typically part of the diagnostic criteria. 73. A patient with celiac disease is having trouble following a gluten-free diet. What should be the first intervention? A. Provide written materials about the diet. B. Refer the patient to a dietitian. C. Assess the patient's understanding of the diet. D. Prescribe a gluten-free meal plan. Answer: assess the patient's understanding of the diet. Rationale: the first step is to assess the patient's knowledge and any barriers they face in following the gluten-free diet. This will help tailor the intervention. 74. Which of the following tests is the gold standard for diagnosing celiac disease? A. Anti-TTG IgA test. B. Genetic testing for HLA-DQ2/DQ8. C. Small bowel biopsy. D. Stool analysis for fat content. Answer: small bowel biopsy. Rationale: a small bowel biopsy is the gold standard for diagnosing celiac disease by confirming villus atrophy. The anti-TTG IgA test, A, is a useful screening tool, but biopsy is definitive. 75. What is the role of vitamin supplementation in managing celiac disease? A. To replace all nutrient deficiencies. B. To help the intestine heal faster. C. To prevent further damage to the intestine. D. To improve adherence to the gluten-free diet. Answer: to replace all nutrient deficiencies. Rationale: vitamin supplementation helps replace deficiencies caused by malabsorption, especially in the early stages of the disease. It does not speed up healing, B, or prevent further damage directly. 76. Which of the following is the most likely cause of diarrhea in a patient with celiac disease who is not adhering to the gluten-free diet? A. Lactose intolerance. B. Pancreatic insufficiency. C. Gluten exposure. D. Crohn's disease. Answer: gluten exposure. Rationale: diarrhea in celiac disease is often caused by gluten exposure, which triggers an immune response and intestinal inflammation. Lactose intolerance, A, can coexist, but is secondary. 77. A patient with celiac disease is advised to consume gluten-free processed foods. What is the main concern with these foods? A. High sugar content. B. Low nutrient density. C. High fat content. D. Cross-contamination with gluten. Answer: low nutrient density. Rationale: many gluten-free processed foods are lower in essential nutrients, such as fiber, vitamins, and minerals, compared to their gluten-containing counterparts. Cross-contamination, D, is a concern but not the primary issue with processed foods. 78. A patient with celiac disease asks about the safety of eating gluten-free oats. What is the most appropriate response? A. Oats are completely safe for all patients with celiac disease. B. Oats are naturally gluten-free but may be cross-contaminated. C. Oats should be completely avoided by all patients with celiac disease. D. Oats can only be consumed in moderation. Answer: oats are naturally gluten-free but may be cross-contaminated. Rationale: oats themselves are gluten-free, but they are often processed in facilities that handle gluten-containing grains, leading to potential cross-contamination. 79. A 40-year-old male with celiac disease is at risk for developing which of the following malignancies? A. Lung cancer. B. Lymphoma. C. Prostate cancer. D. Breast cancer. Answer: lymphoma. Rationale: patients with untreated celiac disease have an increased risk of developing lymphoma, particularly enteropathy-associated T-cell lymphoma. 80. A patient newly diagnosed with celiac disease asks about the gluten-free diet. Which of the following is the best advice? A. Eat only gluten-free processed foods. B. Focus on naturally gluten-free foods like fruits and vegetables. C. Avoid dairy products. D. Gluten-free processed foods are always safe. Answer. Focus on naturally gluten-free foods like fruits and vegetables. Rationale. Patients with celiac disease should focus on naturally gluten-free foods like fruits, vegetables, and meats, while being cautious with processed gluten-free products, which may contain hidden gluten.